Assalamu alaikum. I am Dr. Sharmin Sultana, Associate Professor at Sakina Medical College, Department of Physiology. Today we discuss about growth hormone. Growth hormone is a small protein molecule containing 191 amino acid in a single chain and has a molecular weight of about 22,005. The amount of growth hormone or the concentration of growth hormone in the plasma vary according to age, and its amount decrease or it is very low in adult. It is 1.6 to 3 nanogram per milliliter, and in the children the amount is 6 nanogram per milliliter. When there is prolonged starvation, actually when the body stores of protein and carbohydrate decrease, the concentration of growth hormone in the plasma may be increased as high as 50 nanogram per milliliter. The secretion of growth hormone, not all the day and night it is same, but it secretes as a pulsatile fashion. That means it increase and decrease. Growth hormone secretion increase during sleep. It is observed that during deep sleep, first 2 hours of deep sleep, there is prolonged increase of growth hormone secretion. There are some factors which increase or decrease growth hormone secretion. When there is decreased blood glucose concentration and free fatty acid, then growth hormone secretion increase. But when there is increased protein secretion, mainly arginine, then growth hormone secretion also increase. There are some other factors also which stimulates growth hormone secretion, such as exercise, excitement, trauma. Then there are some other hormones which also stimulate growth hormone secretion, such as testosterone, estrogen, ghrelin and growth hormone releasing hormone. On the other hand, there are some factors which decrease or which inhibit growth hormone secretion. They are increased blood glucose concentration and increased free fatty acid in the blood. Like other hormones such as growth hormone secretion inhibited by some hormones like somatomedin and exogenous growth hormone. Then what are the metabolic effects of growth hormone? Growth hormone stimulate the growth of many body tissues in our body. They causes growth of almost all tissues of the body that are capable of growing. Then metabolic effects of growth hormone. Growth hormone increases body protein. It increases synthesis of amino acid almost all cells of the body. Growth hormone mobilizes free fatty acid from the adipose tissue and it increases free fatty acid in the blood. Growth hormone decreases glucose utilization throughout the body. Thus, the metabolic effects of growth hormone is increases body protein, uses up fat stores, and it conserves carbohydrate. The effect of growth hormone on skeletal framework. It is obvious that growth hormone has a potent effect on our bone and skeletal growth. It increases growth of our skeletal framework by the following mechanism. Number 1, it increases protein deposition in the chondrocytes and osteocytes. These two are bone forming cells and it causes reproduction of these cells also. And number 3, it causes conversion of chondrocytes into osteogenic cell, thus promoting bone growth. So, we can say growth hormone has a potent effect in our skeletal framework. These are the metabolic effects and other effects of growth hormone in our body. Then growth hormone has diabetogenic and ketogenic effect. why we call this diabetogenic hormone and why we call this ketogenic hormone? We call growth hormone diabetogenic hormone because it causes many metabolic effects in our carbohydrate metabolism, and by this effect it increases blood glucose in our body. Growth hormone causes this effect by growth hormone mediated or growth hormone induced insulin resistance. This leads to increased blood glucose concentration, and there is a compensatory increase in the insulin secretion. For this reason, growth hormone is called diabetogenic hormone. Another effect of growth hormone is it causes ketosis. Excess growth hormone mobilizes free fatty acid from the adipose tissue. Under the influence of excess growth hormone, the mobilization of free fatty acid from the adipose tissue becomes so great that acetoacetic acid are formed by the liver and they are released into the blood and thus causes ketosis. This excess mobilization of free fatty acid from the adipose tissue also causes fatty liver in our body. So, for this effect of growth hormone, we call this, it is a ketogenic hormone, and growth hormone has both diabetogenic and ketogenic effect. Thank you.